For Magnum Media, I'm Reed Magnum, visiting with orthopedic physician assistant Sara Horras at SSM Health in Baraboo. And the roles and responsibilities of an orthopedic physician assistant, Sara, can you describe your typical day? What do you do?
Yeah, so my days can vary. It depends if I'm in the clinic or it depends if I'm in surgery. So I split my time between the two locations. In clinic, I'm seeing patients, also going through phone calls, messages patients might send. And then the other days, I assist the surgeon in the operating room, whether that be fixing a torn rotator cuff or doing a knee replacement.
When we think about patient care specifically as a part of the orthopedic team, what are your primary responsibilities?
Yeah, so if I have my own patients, I'm going to be diagnosing them, ordering any tests that I feel are necessary, prescribing any medications. Sometimes I'm putting casts on people for broken bones or a boot or a brace. Kind of also help the surgeon looking, for any patients that are coming up having surgery, any concerns we might have, any other prerequisite work they might need done prior to surgery. And then I assist the surgeon in the operating room, and help doing orders for after surgery if they're going to be admitted to the hospital.
I know collaboration is huge with SSM Health, especially with the orthopedic team. How do you collaborate with the surgeons, the nurses, the other healthcare professionals in your role?
Yeah, it's definitely a team approach. We rely on our nurses to kind of help fill us in on what's going on with patients. We're not in clinic necessarily every day, so sometimes the nurses are kind of our first line too for triaging patient phone calls. Does somebody need to get in sooner? Is this more urgent matter? We work with physical therapists a lot, helping, whether they are seeing them after surgery for recovery. They're seeing the patients more often than us, so sometimes they alert us to any concerns that maybe, hey, we need to see this person sooner. And then sometimes too we're seeing patients for the surgeons who are busy, and if we have concerns we might alert them. So it's definitely a team approach, and we're always kind of communicating amongst each other.
What procedures are you most frequently involved with in the orthopedic department?
In the clinic, probably a big thing that I do are injections, steroid injections to help with pain, inflammation, and different joints, so that's a common one. I think I mentioned earlier, putting on casts for people with broken bones. And then on the surgical side, assisting the surgeon with surgeries.
Well, people seeing this want to make an appointment with SSM Health Orthopedics in Baraboo. What's the best way for them to do that?
Yeah, so they can go to our website, ssmhealth.com, and they can search orthopedics and type in their zip code, and our information will come up. They can also reach us by telephone at 608-294-6464.